So before undergoing a hernia surgery, sometimes we need to evaluate certain conditions which can increase the risk of hernia recurrence after the surgery. Patients having some conditions like asthma, chronic cough, or patients who are having prostate problems or urethral strictures or constipation. These patients tend to raise the intra-abdominal pressure constantly. Like when you strain a lot to pass motion or strain a lot to pass urine or keep on coughing, the intra-abdominal pressure increases and there is a chance that the hernia repair may get disrupted after the surgery. So if you are having any of these conditions, it is very important to get these conditions evaluated and corrected or addressed before the operation. If you are continuously straining after the operation, after the hernia surgery, it's very likely that you may get a hernia recurrence. So whatever be the kind of hernia, whether it is a ventral hernia or an inguinal hernia or an umbilical hernia, whatever be the kind of hernia, if these things are not addressed adequately, there is a chance that you may get a hernia recurrence very soon after the operation. Especially elderly patients, men who are having prostate problems, like they are having a benign prostatic hyperplasia, they have outflow obstruction, they have to strain to pass urine. So it's very common in men. These patients, you need to do certain tests like ultrasound with post-void digital urine and uroflowmetry. And if there is any outlet obstruction very evident on the scan and the uroflowmetry, it is important to start them on some medications to improve the obstruction. Sometimes if this is not getting corrected, you may have to undergo a surgery for the prostate also simultaneously or sequentially. Some patients are having urethral strictures, that is narrowing of the urinary passage, that is the urethra. So if that is there, then they will strain constantly to pass urine. That also is an important cause for raising intra-abdominal pressure and hernia recurrence. Asthmatics, smokers, these people are having chronic cough, and asthma patients who are not adequately treated, it's very important to optimize, see the pulmonologist, get the asthma under control, bring down the cough, and then go for hernia surgery. Similarly, patients who are having chronic constipation, it is very important to take diet rich in fiber and treat the constipation before you go for hernia surgery. These are the few important things which can be modified and corrected before the operation to prevent recurrence of hernia after the surgery. My name is Dr. Dattaram. I am a consultant surgical gastroenterologist and a laparoscopic surgeon practicing in Hyderabad.